Read less, more TV.
I think he should have the right to know what it is we do with his $100 million. Please welcome our new chairman of the board, Edward Vogler.
$100 million. $100 million! That's an Austin Powers level of cash.
$100 billion.
I find it very interesting that he can just buy a seat at the board with that much cash. Is that realistic? I wonder what his intentions are. I'm sure it's not to be a modern day saint. Very excited to be reacting to House MD Season 1, Episode 14. On this channel, we are reacting to all 177 House videos. This would be episode 38. Let's see if I can get the diagnosis before House does as a doctor working in London.
Carly, I was wondering, could you walk us through what you were thinking for other Asian territories?
Oh, right now I have a meeting and I need the room.
We were just getting started.
I can't move my leg.
Ooh, that composure from Carly. No wonder the episode is called Control. We saw evidence of tremor, muscle spasm, paralysis in a 35-ish-year-old female business executive. What could this be? The spasm with paralysis makes me think of an upper motor neuron lesion. Seemed like this is sudden and unexpected, which matches with a stroke. But even though stroke is an upper motor neuron lesion, in the acute phase, it actually causes reduced muscle tone, and then in the weeks following, slowly builds up that tone if there is residual deficit. So this doesn't fit with stroke. Another possibility is multiple sclerosis. That would be big on the differential with her demographics. But then again, that's usually slower onset, subacute, rather than sudden paralysis or weakness. She also mentioned earlier that she was up until 3 in the morning. Drug use will be there on the team's list. She works in a high-powered job in the city. Bathroom setup might as well be taps, hand towels, cocaine dispenser. There have been reports of paralysis due to cocaine use, but they would be very rare and a bit too easy. Could also be an arterial clot like House had. She travels a lot, it's sudden onset. Let's get some more clues.
She's the CEO of Sonyo Cosmetics.
She may have what you had, a clot in her thigh.
Chase, put her on blood thinners, do an angiogram, MRI the spine. If that's clean, cut her open and biopsy the leg.
Okay, so the team liked the arterial clot suggestion, but of course, it won't be that. Also, it's fairly obvious usually if a significant clot is present, as you'd get the 6 P's of acute limb ischemia: pain, paralysis, pallor, pulselessness, paresthesia, and perishingly cold. They really tried hard to get that last one in, didn't they? Perishingly cold. Could have used poikilothermia, which means an inability to regulate body temperature, independent of ambient temperature, like a reptile. I love what House does with the management plan here, giving a multi-stage approach, which means the team don't need to keep coming back to him after each investigation. That's a method used by Professor Cal Newport, computer scientist and author of international best-selling book Deep Work. He says to reduce email burdens when responding, give multiple stage plans, thinking ahead to what the next steps might be. It also helps to communicate what your intention or rationale is for a particular project. Not so relevant for medicine though, as hopefully everyone's aim is to keep the patient alive. If you'd like to learn more about achieving that deep work state, then check out the links down below. You can get access to his free audiobook with a trial of Audible, and they are affiliate links, so if you do sign up, you will be supporting the channel at no extra cost to yourself. So check those out. Speaking of books, seems like Cameron's been reading some, as she's been using some interesting persuasive techniques to try and get others to agree with her suggestions, making it seem like it was their idea, asking them questions that lead them to those conclusions. House said he wouldn't be persuaded by it, but he basically then went ahead with her suggestion. I love this series.
Read less, more TV.
I think he should have the right to know what it is we do with his $100 million. Please welcome our new chairman of the board, Edward Vogler.
$100 million. $100 million! That's an Austin Powers level of cash.
$100 billion.
I find it very interesting that he can just buy a seat at the board with that much cash. Is that realistic? I wonder what his intentions are. I'm sure it's not to be a modern day saint. And I'm even more sure that House isn't gonna like a boss that's more resistant to those bright blue eyes.
And overnight, I was worth $1 billion. So I went to see my dad. His Alzheimer's had taken a turn for the worse. And that is why I'm here. I am writing you a blank check to fight back.
Wow, okay, so he did the Warren Buffett method of investing in multiple companies, and that's how he made his billions. Not bad, Vogler. Although, why invest in a single hospital to make progress on developing new treatments? New discoveries are made by universities and pharmaceutical industries, not hospitals. It's like going to McDonald's and asking for a stuffed crust. Speaking of billionaires giving back though, you'll be surprised to know that the record holder that's donated the most to philanthropic causes is Jamsetji Tata, an Indian pioneer industrialist who donated the equivalent of $102 billion in today's money when adjusted for inflation. What a legend. Let's see if Vogler is the same. But even his name sounds evil. Vogler.
Who's that?
It's just one of our doctors.
Aren't doctors supposed to wear lab coats?
He's different.
Everyone's buddy. And why does he get away with it?
You think that's bad, Vogler? Wait until you realize your 100 mil just about covers House's medical defense bill. Interestingly, doctors don't actually wear white coats in the UK because they're an infection risk. The evidence to support this is about as strong as Vogler's hairline. So a 2022 article by the British Medical Association mentioned that one possibility may be to reduce the amount of influence doctors have on the NHS because we had so much already. I have to say though, it is a shame to not have that uniform that binds us all together, although the stethoscope does have a similar effect. What do you think? Should doctors wear white coats? If so, why? Answers down below.
He can't talk. He had knee surgery.
It's very dangerous operating so close to the vocal cords. Sorry.
I love these House clinic scenes. House's wit just hits a peak. It sounds a bit far-fetched, knee surgery, vocal difficulties, but if he needed an anesthetic, his vocal cords could have been damaged while putting the tube into his throat. If that were the case though, he'd still likely be able to make sounds. The fact he's not saying anything makes it seem a bit more likely to be voluntary than physical. Hopefully we find his voice later in the episode. Maybe it's locked in a magic box. Who knows?
I need you to wear your lab coat.
I need 2 days of outrageous sex.
Wear the coat.
He's gonna kill this hospital.
Our initial tests say you're fine.
Interesting, a new symptom. She was holding her right hand. Seems like her paralysis has happened again somewhere else. All the tests were normal, means whatever it is, it spreads without a trace. I'm assuming the blood tests were normal as well. What would fit this case really well is if she's on drugs, which she probably is since nobody's tested her, and she has vasospastic limb ischemia. As a response to the drugs, the arteries spasm, closing themselves off and restricting blood flow to the area of muscle that they're supplying. And then as soon as the spasm relieves itself, poof. Gone like your cash in Bangkok. They can pick it up by using a CT angiogram or duplex ultrasound and trying to induce the spasm with ergometrin. Treatment could be with alprostadil to relax the vessels. Now, if you're relaxed watching this video and want access to exclusive perks, check out the channel membership. Not only does it help me a lot, but you also get priority suggestions for new videos, including series and episode, and early access to them as well. For a limited time, the first 30 members will be in with a chance of winning a one-on-one tutor session with me on a medical topic of your choice. We've currently got 10 members, so make sure to join now to secure one of those other 20 spots. The earlier you join, the earlier I can react to your suggestions as well, so press join now.
What was her sedimentation rate?
15, Allison.
If 15 is high for Carly, then she has inflammation.
Which could in turn mean cancer.
There's a very quick test to see if you even have it. A colonoscopy.
I don't want to be looked at.
Interesting, so the team think that Carly may have cancer from a normal marker of inflammation in her body on the assumption that it may be abnormally high for her. That can be true, but would be insanely rare, and they also don't have previous blood tests for her to check what the trend is. Another thing is that if the SED rate, which is the ESR in the UK, is high, your primary suspicion isn't cancer, it would actually be a rheumatic autoimmune process like lupus, for example. I know it's not lupus, but could be lupus. She could also have infective endocarditis and be throwing off clots to random parts of the body. Should really echo the heart for completion here, but I would definitely want to try and catch that arterial vasospasm with the help of ergonovine and a scan here, rather than doing a colonoscopy straight up. Also, you can screen for colon cancer using a simple feces test before doing a full-blown colonoscopy. So fair enough that the patient's refusing, even though her mum did have bowel cancer. You can also do a CT colonoscopy where you don't use a scope but still need bowel prep. It's less sensitive than an actual colonoscopy, but still pretty good. So let's find out more.
We could do a virtual colonoscopy.
This might sting a little. I want to see you again real soon.
Did House actually just use the made you look technique to jab his voiceless patient in the neck? Brilliant. House tracked down this patient's orthopedic surgeon early in the episode to see what happened during his knee operation to put him on mute, and the surgeon had no clue. Patient got $1 million in compensation though. Quite a spicy settlement. Now it seems like the procedure House was doing was an injection laryngoplasty. In the real world, it's a very fine procedure to help the patient's paralyzed vocal cord move closer to the center, so it closes the gap and helps the body to produce those sounds, bringing the voice back. Think lip filler, but for your vocal cords. It uses hyaluronic acid, which are in lip fillers, and another agent called calcium hydroxyapatite that stimulates collagen formation. Usually it's done under the guidance of a nasendoscope, as the vocal cords live inside something that's relatively important, the trachea. So if our filler substance decides to go on holiday, it's going to redirect us from the Maldives to Mordor. Breathing ain't so easy in Mordor. But no, House can freehand it while the patient counts the dots on the ceiling because he's House. Another interesting thing you may be wondering is how do they jab their actors with those needles? They actually have a retractable stunt syringe which doesn't break the skin. You can tell that's what it is because the patient's still breathing. Also, if you look closely, you'll notice that when House puts the injection into his neck, he has a dimple on the skin where the needle's gone in. Now, if it were a real needle, that dimple wouldn't be there, as there would be no resistance from the skin, as the needle would have penetrated through it, losing any elastic tension that might be there. Pretty smart.
No colon cancer.
What happened to a regular old-fashioned colonoscopy?
She was uncomfortable doing any more tests.
She's scared.
But not of tests, just embarrassing ones.
Well, what if she actually wasn't scared of the test? What if she was hiding something downstairs, like a penis? What if she was born a he? There was a case from Japan in 2015 where a 30-year-old male presented with numbness, paralysis, double vision. It wasn't until a month after that they realized he had right scrotal swelling and testicular lymphoma presenting with neurolymphomatosis. Seriously, if I called that from that colonoscopy decline, that would be epic. Vasospasm theory due to drugs, still on the cards too.
I thought you said Carly's angio was clean. Either she literally has 2 left feet or you angioed the wrong leg. How come some resident signed this radiology report? Were you even in the room?
Seems like Chase screwed up here since he wasn't even in the room. I can see the tension building up between Chase and Cameron as well. Maybe they snuck off with each other and left the junior in charge. Although Chase is 26 at maximum, so he should be a junior here as well, unless he skipped 5 years at school. Medical errors actually happen more frequently than you might expect. There are so many different factors that make it possible. Dealing with multiple patients simultaneously, difficulty in systems communications, poor maintenance of equipment and drugs, complex multifactorial problems to take into account. The list goes on.
I can't breathe.
Respiratory arrest. Call a code.
Foreman did a thoracentesis to drain the fluid from her lungs. Angio revealed no clot.
Interesting, so you saw how when they zoomed into the lungs, that fluid was quite watery. That tells us a few things. Firstly, it's likely to be a transudate rather than an exudate. What does that mean? It means that the fluid buildup was because of a slowing down of flow rather than an intentional secretion like it is in an exudate. That slowing down of flow could be because of things like heart failure or lymphatic obstruction, like in a testicular lymphoma. Exudate could be caused by things like pneumonia and tuberculosis. There are a few things to note here though. If it were a large enough effusion to cause a respiratory arrest in a healthy 32-year-old woman, they wouldn't just suck it out with a needle, which is a thoracocentesis that Foreman performed. because it would just fill right back up. You would want a chest drain to catch future fluid as well. Secondly, an infusion wouldn't cause such a sudden deterioration like what we saw, as the fluid builds up gradually, not because of a sudden catastrophic accumulation. So this situation isn't quite realistic, although it does make for great television. What would make for even better television though is if she has testicular lymphoma. Give me my own show.
Carly needs a heart transplant.
We'll get her on the list immediately.
She's already on the list.
Oh, I told him to do an echo earlier. Has was a few steps ahead of his team there. The question is though, how did he know from the self-harm marks? If she's depressed, maybe she takes tricyclic antidepressants. In overdose, they can cause cardiotoxicity by blocking the sodium channels and affecting the conduction system. But when she went into respiratory arrest, we didn't see a cardiac arrhythmia on the monitor's trace. So either House knows something else or it's not quite accurate. He must know something else. Maybe he didn't stop at the thigh and found the scrotum. You can't just transplant someone though without knowing what caused the toxicity in the first place.
Are you sleeping with House?
No, that's an incredibly inappropriate question.
You're a high-powered bulimic. You have to find the most efficient way to vomit.
Wow, how did House get to bulimia just from the cutting? Guess that's why he has his own show and I'm in my bedroom shooting this video. Perspective. Bulimia nervosa is an eating disorder where patients have an irresistible craving for food with an intense fear of being overweight, so they then vomit the food that they consume intentionally. Patients with this condition are actually usually either a normal weight or slightly overweight. Usually short-term vomiting can be hidden, but in the long term you do get damaging effects, especially to the teeth, due to excessive exposure to hydrochloric acid. You can also get Russel sign in the hands due to calluses from repetitively putting the hand in the mouth to induce vomiting. So there would be signs of this most likely unless she's been strategic about hiding it. Also, Vogler is really grilling Cuddy here, saying that the Department of Diagnostic Medicine is a black hole sinking 3 million a year and sees 1 patient a week. No wonder it doesn't exist in the real world. 5 doctors, 1 patient. To be fair, during lockdown when I was on cardiothoracic surgery, at one point we had 8 doctors with only 2 patients because all non-emergency procedures were stopped. Pretty crazy.
You found a common antidote to accidental poisoning to do the job. Ipecac causes muscle damage and destroyed your heart. I am required to tell the committee about your bulimia.
Oh, House has figured it out. That's how she didn't develop the hand signs at least. She was using Ipecac. It's obtained from the dry roots of the Ipecac plant and acts through alkaloids emetine and kephaline. They locally irritate the gastric mucosa and centrally stimulate the medullary chemoreceptor trigger zone to induce vomiting of ingested contents. So she doesn't have to get her hands dirty. Literally. You may be wondering what use a medicine that makes you vomit would ever have. And it was initially used to try and vomit up medicines when an accidental overdose happened, like your kid just swallowed a whole bottle of paracetamol. Now in 2005, which was exactly when this episode was released, there was a huge trial that included a comparison of Ipecac to activated charcoal for reduced absorption of toxins, and it found that activated charcoal was much more effective than Ipecac due to its very absorptive properties. Ipecac isn't very useful at all at preventing absorption, so it's actually been discontinued. Still interesting to see though, there was actually a very interesting case published in the Journal of Clinical Cardiology in 1998 of a 26-year-old woman who developed cardiomyopathy due to chronic ingestion of Ipecac 3 times a week, exactly the same as our patient. Even with that though, her mild heart failure was reversible after stopping use of Ipecac, so she wouldn't technically need a new heart, although that would be boring, so let's assume she does. Now, if the committee finds out she has bulimia, it's likely she'll be seen as too risky for having a new heart.
So you're here to tell me I have just a few hours to live?
Unless I lie to the committee. But if they find out, I lose my medical license.
Am I worth it?
I'm asking you if you want to live or die.
Oh, it's these tough scenes and decisions that make House as spicy as it is. House is stuck between lying to the board to save her life and letting her die because of her own actions. I also love how the episode really humanizes her, showing her as a high-flying executive who has this huge secret It does raise this interesting question though, how can people be so externally successful but so internally unhappy? Is it their fault? Sonyo Lyubomirsky, professor of happiness, addresses this exact question in her book, The How of Happiness. She says that life circumstances can only contribute 10% to overall happiness levels. The rest is made up 50% from genetics and 40% from your values, attitudes, and habits. The last bit is what we can really influence and what we should focus on. Things you can do to help that include getting a job in a field that matches your values, or fostering strong relationships with your loved ones, and working hard to create that feeling of contribution to others. House wants her to fight for her life, to see that she's worth putting his career on the line to save her. Incredible.
I don't want to die.
It appears that you put Carly on the transplant list before you did these tests.
I had a hunch.
Oh, this is getting very spicy. Cuddy has just called out House on the investigation. She knows he always has a reason, even if it's a dumb reason, and she's been under pressure the whole episode by Vogler, saying that she's too light on House, and I'm sure he'll be watching the outcome of this hearing if he's not there already. The circumstances are not looking good for House and Carly, as Cuddy probably wants to show that she's a strong leader here and lay down the law. There's a smell in the air, and it's not roses.
You don't have hunches. You know.
God.
Is there any exclusion criteria we should know about?
She's a little blue.
The setup here is just perfect. Well done writers for coming up with this one. That being said, if House isn't successful here, then this patient would be a perfect candidate for what's known as a ventricular assist device. It's basically an artificial pump that supports the heart in people with weak or failing hearts. Patients can live with it for up to a decade, but it also takes open heart surgery to install. Basically, it takes blood from the left side of the heart and pumps it into the aorta, replacing the function of the left ventricle. Let's see if House gets his proposal passed.
My patient's getting a heart. Oh, will you stop it with the book?
Because people don't like me.
Everyone likes you.
Do you?
This is what happens when you take a girl out on a monster truck date like they did in the last episode. He's now irresistible. I do like Cameron trying to stand up for herself because she's been feeling ignored here. What can she do? Ultimately, she's got a choice to make. Accept how things are or try and do something about it. And she chose the second option. It's tough to blame her for that, even though House has noticed her using one of these books. To be totally honest as well, I've read Never Split the Difference, which is a negotiation book by Chris Voss, FBI negotiator. And most of the techniques of influence are basically phrasing things as if you're looking at it from the other person's perspective. Is that really such a bad thing? Maybe the world would be a better place if we stood in other people's shoes more often. Okay, rant over.
No.
Textbook. She'll outlive us all.
If you can talk, blink twice.
House cured him with that very interesting injection, apparently of Botox, which was supposed to release the tongue from a condition called lingual dyskinesia. It's actually a movement disorder related to long-term use of anti-Parkinson medication, not caused by trauma. So I don't feel too upset that I got it wrong earlier. Okay, that's a lie. It's actually killing me. The only thing I hate more than wellness gurus is being wrong. What if I'm wrong about wellness gurus? If you're wondering why the patient was blinking when he could talk, it's because he was worried that he'd have to give the settlement back if he could speak, but House told him he doesn't, so it's their little secret. This episode is so much fun. 9 out of 10 for entertainment, 7 out of 10 for accuracy, 9 out of 10 for diagnosis. Would have been a 10 out of 10 if it was scrotal lymphoma.
Why did you fight for me?
You're my patient. Don't screw it up.
The nurse found this in the patient's purse.
You don't like me, or I'm not gonna like you.
Vogler knows about the pills. House is in deep trouble right now, and I can't wait to find out how that all works. I'm gonna love this arc between House and Vogler. Seems like he's playing hardball with Vogler, saying that he can't get rid of him because he's got tenure and he would need a unanimous agreement from the board. But Vogler knows it's easier to fire Wilson and Cuddy than it is to fire him. Can't wait to find out what happens in the next one. For now, it's my turn to diagnose you. Seems like you've got a house reaction deficiency. Oh look, the cure's popping up right there. Go on, treat yourself. I'm Sermed, stay curious.